let's just talk about the spine. So the spine is, a series of vertebral bodies that have a disc in between. They also have processes that come out from the vertebral bodies that then have joints. We call these the facet joints. If you tried to stack 100 pounds onto a column with discs in between, it would wobble and fall over when you initiate any horizontal movement. The thing that keeps the spine stable is this series of muscles on the sides of it that then use the facet joints to deal with all of the asymmetric loads that hit the spine when we walk or initiate any sort of activity. So in order to keep the spine stable and to protect all those nerve endings that come out, back pain is not about injury to the spinal cord, it's about injury to in most situations, the pain is injury to the nerves that come out, all the pinching and stretching it undergoes. So to protect those nerves, you have to have a strong muscular support system. And to build that, you need to then have a strong core. You need to have the supporting abdominal muscles, you need to have the pelvic floor muscles, the butt, and then the limb strength. But that ability to stabilize the lumbar spine, to deal with the asymmetric assault that walking places on the spine at any time, is absolutely essential for living on 2 feet. Typically, those are going to be to strengthen those muscles that go all the way up the spine, which are called the multifidus muscles, the multi-muscles. There's something like 200 of them. Then you're going to have to move the spine from a vertical position into a horizontal position. We typically have people work on a ball so that the spine doesn't overextend or doesn't overflex, and place a load that can either be on the head or on the feet, so that you're lifting up one end of the spine and protecting it from arching in any way or twisting in any way, and building the neurologic connection to each one of those muscles all the way up and making them strong again. So typically we put somebody on a big Bosu ball, put their hips on there in the middle, and have them with the facing down and have them do kind of a reverse sit-up. And what that does is it keeps you from arching the spine. The ball won't let you do that, but it forces the muscles along the spine to activate. And that's typically the first set of exercises we have people do. And then, sometimes we roll them over further and, have them lift up the legs. But typically using that ball keeps people from using the erector spinae and arching the spine. And so by doing that, we're able to build a stability. So really using a ball is kind of the first element to starting to build those muscles. So then we start to once we get the coordination there and the ability to strengthen the multifidus muscles, then we start doing asymmetric exercises. So what you see a lot of folks do is they go to the gym and they're doing squats and things where you're protecting the spine when you're doing the exercise, which is good. But when you're walking, you're dealing with an asymmetric load. So one of the exercises we have people do is to practice lifting up a weight in one hand. So you're exaggerating the force that goes through the hip and then goes into the spine. And the spine has to activate when you're lifting up a weight with one hand. So one of them is just lifting it up off the ground. The other is putting your one foot on a step and lowering the other foot down below the step while holding a weight. And that asymmetric load then is fairly complicated in how the hip has to transfer the forces. But that motion is exactly what keeps you from falling over. So we try and duplicate the assault that tripping or trying to get over uneven surfaces will place on the spine. what's really we're so blessed with is when I first started training athletically, the general knowledge if you went to a gym of how the neurologic system works with the muscular system was incredibly rudimentary. And we've been blessed, I think, in the last 15 years of an explosion of knowledge. And I think the internet has been incredible in terms of the ability to share information. So I think most cities have within them a cohort of personal trainers or whatever who really know what they're talking about. I mean, there's some people who sort of do it for the money or not that interested, but I know in our city, in Santa Fe, there's at least a half a dozen folks who are incredibly knowledgeable, incredibly meticulous about understanding the coordination and the adaptive process necessary to build muscular strength, because it's not just muscular strength, there's also coordination. We talked about an asymmetric load that requires an enormous amount of information moving from your muscles, your joints, your cerebellum, your inner ear, putting that all together. You have to master the movement in order then to build the musculature. And that process takes time, patience, and usually the assistance of somebody on the outside. It's very difficult to do this on your own because you're developing a refined skill set. So what I would say is I would highly recommend that, and I do this with all our patients, finding a personal trainer who's got an incredibly meticulous eye, understands progressive training both on the coordinated front and also the strength front.